we're going to go over some common delivery positions and ways that a partner can be helpful and involved in the process. We'll start most common, dorsal lithotomy in a hospital-like bed with feet in stirrups. So as the partner, what you want to make sure you're doing to support limbs is use as much of your body as possible, because that's how you're going to make sure you're not wasting a lot of your energy and you can do what you need to do for as long as it needs to be done, which could be minutes or hours. The thing that you can do to help is control rotation of the hips here. If there is an epidural, they might have a hard time with that, so just controlling legs, or it just might not be the thing that the mom wants to be worried about. So, easy enough. You want to position yourself as close to the person delivering as possible, and you want to use your body. So, Ellie is going to just let her leg relax into my body. I'm kind of leaning into it so she feels secure, and this is just how we can give some external rotation support so her leg just doesn't flop out. Alternative for theoretically opening the pelvic opening more, hip internal rotation will help with that. So bringing the knee in and foot outside of the hip a bit puts the hip into internal rotation, which in theory should make it easier to give a bigger opening for baby to come through. So in this case, again, you're staying close. Make sure ankle is outside of the knee, and you're just using your body to hold the leg up. So most common. Now we're going to talk about ways that you can support the whole leg. Maybe you're having an at-home birth, or you want to help with giving some counter pressure so mom has something to push into or pull against to make her pushes more productive. So what that will look like is cradling the leg like it's a baby, using your belly like an extra hand so that you're not holding a leg out here where your arms are going to get really tired really fast no matter how strong you are. So using your body, leaning into it. Mom should feel very secure, like they can just let their leg be a noodle. A sign that they're not comfortable and relaxed is if they're like able to hold their leg up on their own. So you should feel like you're holding a noodle. The other piece that's really helpful when you're holding a whole leg, legs are heavy, is to use more parts of your body. So something really easy, typically beds will be low, is to just put your leg up, and now Ellie can rest her leg on my leg. I'm not doing a lot of work. I can comfort up here if I need to, and I could do this all day long. To help make pushes a little bit more productive, so mom doesn't have to work harder than she needs to, you can help by providing some pressure. So two options here. One is to have something to push into. So two ways to do this. One, I'm going to use my leg to support. I'm going to keep my body and my arms close to my body, and then I'm going to have Ellie try to punch my arm through the door. Awesome. That one is okay. It's not a lot of work for me to hold the leg up, but my arm might get tired here, so an alternative would be positioning my body over here more. Now Ellie would have to kick over my whole entire body, literally, which she probably could, but if I lean into it, I'm going to have the advantage, and then this is easy for me. She can push as long as she needs to. You can move your leg over to give room for baby to come out here, but this is another option for pushing. Some people might feel like they can get more force output with a pull. So in that case, what you would do is have her drive her knee into your hand. So she's trying to pull her knee to her chest. That's one easy way to do it. Alternative would be to just position your body over here, and then she can pull into you. Make sure you're in like a nice lunge stance. Go again. There we go. Okay. I would recommend practicing all of those. If you feel tired just in like 5 minutes of practicing that, then I would really focus on getting your body closer to your partner, using more of your body, your belly and your legs to help hold the limb up, and those should help with you not spending as much energy, and you should be able to help for longer. So this is another great position that you can labor and deliver in. So we'll focus just on the delivery aspect of it. This position is great because mom has a lot of control over what she does. She can drive her knees down into the table. She can kind of pull down and push if she needs to. She really has a lot of control over her whole body. The only thing that she may need help with, positioning wise, is if she had an epidural and doesn't have a lot of like pelvic control. So what I would do in that case is I would use my belly and my body to support one side. So I'm leaning into her right now, and my arms are going to come over the top, and I'm thinking about pulling my armpits down and back to give good squeeze here, not pulling with my biceps because biceps are going to get tired quick. So I'm giving pressure here to control, and then I can help control whatever way she wants to go just by leaning my body around. The other thing you can do here that may give some relief if discomfort is really intense is giving pressure to the hips this way. So if you can tolerate it, giving a nice squeeze here, or similar, we're just giving a lot of pressure and trying to squeeze her hip bones together. Higher up on the hips, not so much at this bony widest part, but higher up here. And those are the ways that you can help in this all fours position. You can also do back rubbing and anything else that your partner feels relief and feels nice with. Get that oxytocin flowing. We're gonna go over the same information. We're just in side lying now, which is a great position to deliver in. So, same fundamentals apply. Getting my body close to hers, and then using as much of my body as I can to support. So if she were at the end of that table, that way I would, in a nice moment when things are calm, have her come back, or honestly, just get as close in there as you can. So I'll show you from the front, or from the back, and from the front so that you aren't in the way of any providers who need to be in this area. So, things to help with. Holding the leg. If I have her out here, that's going to get exhausting again. So I'm going to hold her. I'm going to rest her on my hip if I can, hug her leg into my belly, and use as much of my body to support her as possible. Now I'm not really using a lot of arm energy. The biggest thing I'm doing here is taking her leg and squeezing it into my body this way. So I'm using bigger muscle groups to help me with that. You can cradle a leg here or a hand here if her leg is feeling a little floppy, but similar to in dorsal lithotomy, now we can help with externally rotating, internally rotating to open up the pelvic opening a little bit. And something that applies in all positions, sometimes it can be a little bit more comfortable to bring knee to chest more. So with that, I'm going to come around and show what that would look like. But before that, here we can also give pressure to push into. So I'm just putting her foot in my hip crease. I could do this all day. Alternative, put her right in my bicep, squeeze my arm into my side, and she can kick me away here. Or she can pull into my chest, or her knee into her chest. Okay. I'm gonna come around. Here, I would use body because you likely won't be in the way of any providers. So I have her leg resting on my leg. I can put my hand here, lean back, and just have her kick. I'm not really using anything except for my passive weight to resist her here. Or she can drive her knee into my hip. That's perfect. And sometimes, like I mentioned before, it can be helpful to bring knee up to chest more. So then you can be right by your partner, which is nice. And same rules apply, just keeping elbows in, hands close to your sides, and supporting here. You can get a little stool to put your leg on, whatever you have available.